Hello everyone, I'm Dr. Sushmita and welcome back to our channel. Our product today for discussion is Waldent Rct-pex. Waldent Rct-pex is pre-mixed, syringe-delivered, radiopaque calcium hydroxide paste with Iodoform. Iodoform paste has high antibacterial and bacteriostatic properties, easy resorbability, and is non-toxic to the periapical tissues and the permanent tooth germ. Waldent Rct-pex has strong antiseptic properties as it contains Iodoform. It is a non-hardening paste with oil base. It has easy handling and direct application. It creates secondary dentine due to prolonged release of calcium hydroxide. Rct-pex is used in apexification and hard tissue formation, as a temporary and permanent filling material after pulpectomy, in root resorption cases, in cases with periapical lesion. As Waldent Rct-pex is thick in consistency, it is provided with a wide plastic dispensing tip. Attach the plastic dispensing tip to the Rct-pex tube. And check for a smooth flow by gently pressing the plunger. Insert the plastic dispensing tip of Rct-pex into the middle of the root canal. Now slowly press the plunger of the syringe and inject a continuous flow of paste into the apical area. Then gently pull out the plastic dispensing tip and notice a reverse flow of Rct-pex into the pulp chamber. Remove the excess material with the help of sterile cotton swab. Well, that's all we have for today. Thanks for watching.